I love being a nurse, and it's something I wanted to do from about the age of 15.
We absolutely need to continue to celebrate the diversity of our people.
I think this is a really exciting opportunity. We are really focused on what the nursing and midwifery profession needs to do for the population of this country.
They can see you as a person of colour, and when I grew up through nursing, as Duncan's already alluded to, there weren't people who looked like me in senior positions.
I do have to pay tribute to my colleagues in the profession who continue to show up every single day and do the best they can to provide care in those very difficult circumstances. We've seen some vile examples of, racism and abuse towards our international colleagues.
It's important to mention that there are a lot of great midwives doing some amazing things out there.
I still hear too many times colleagues say, well, you can't start your career in a community setting, you've got to start your career in a hospital setting. That's nonsense.
I think it's really important for people to understand what an amazing thing that you'll be doing to join this amazing profession. And I would say go for it.
Voices of Care, the healthcare podcast.
Welcome to Voices of Care. Nursing is said to be the backbone of our healthcare system. I'm therefore delighted to welcome two celebrated nursing leaders to this episode, Karen Bonner, the Chief Nurse for London, and Duncan Burton, the Chief Nursing Officer for England. Karen, Duncan, welcome to Voice of Care. Thanks for making the time to join us today.
Thank you.
It's a pleasure. I want to start, if I may. We've got a lot of things to cover. It's a very seminal moment for nursing, a defining moment, perhaps even. But I want to take a moment to talk about your own journeys. You're at such a senior role, leading London nationally. Duncan, if I can start with you, I know there's some family connection. I think your mother worked in a care home. Your father was a public servant as a policeman. But I think it was work experience in the teens that was a defining moment to joining the profession.
Yeah, well, look, thanks for having us here today. I love being a nurse, and it's something I wanted to do from about the age of 15, and it probably stems from, as you said, I grew up in a household of public service, actually, and I went and did work experience in the Royal Sussex County Hospital when I was 16, which cemented, actually, this is the thing I want to do, and went off to university when I was 18 to train to be a nurse, and I have to say, I couldn't think of doing anything else. It's given me so many opportunities. And personally, my mum would be shocked. I can even come into a room like this and do a podcast. I was really shy. And I do genuinely think nursing has given me a confidence that I would not have got otherwise. So it's those opportunities, that connection with people, and this is why I'm so enthusiastic about getting young people, attracting people into this profession, because it's just amazing. I've just loved every minute. I'm sure, Karen, you're the same.
Karen, you've obviously received an MBE for your contribution in nursing, and your, I think, dedication. I think we have to doff a cap to the Windrush generation, and your mum coming from Barbados and joining the service, I think.
Absolutely. So thank you for having us again. And
You're
it's a
welcome.
real honour to be honoured for nursing, because actually it's my life's work as it is Duncan's. So my mum and dad, as you know, part of the Windrush generation. So I'm a proud descendant of the Windrush. And my mum actually came here to be a nurse, and she didn't fulfil that, because she always say she met my dad, he scuppered her plans. But
Yeah, four
she
children.
had 4 children, and so but she did become a support worker.
Yeah.
And I know when I look back, that really inspired me, because through that, she always sort of knew what to do to fix us. So I don't actually remember wanting to be anything else.
So
If I'm honest, it was always like ingrained in me to do that. So as soon as I left school, I just wanted to get into nursing. So I was aged 18, same as Duncan, going into the profession.
wow. So great testimonies, both of you. Just looking at the national landscape briefly, if I may, it's record numbers, 860,000, I think, on the NMC register. So continuing to grow, including nursing associates. But it's also a time of tremendous pressure. I just wanted a brief observation. I think that you can take any stats you want, but people leaving A&E, for example, without treatment, has gone from 100,000 in 2019 to 320,000 in 2025, delayed discharges. Talk a little bit about corridor care, because that's been on the press throughout many, many months, in terms of the impact on nursing being able to do their job.
Yeah, absolutely. Look, and corridor care is terrible. It's not anything any of us want. It's not something I would want for my mum or my dad or any of my family. And I know every single nurse in this country and health professional does not want this to be the level of care that we're providing. So it's really critical that we get out of this. And, you've mentioned the pressures. There's an exceptional amount of pressures driven by lots of different factors. We've got an aging population, we've got a sicker population, which is why, and I'm sure we'll come on to talk about the 10-year health plan, but, this is why actually this is a combination of things that need to happen to really drive improvement in this area. How do we get ahead of people becoming sick? How do we get the population healthier? So this real shift from sickness to prevention is really important in this space, as is actually how do we move and shift services from hospital to community. So actually we depressurize the hospitals. But, I do have to pay tribute to my colleagues in the profession who continue to show up every single day and do the best they can to provide care in those very difficult circumstances. And look, and I've had to, and I'm sure Karen has over the years, had to provide care for patients in corridors. It's not what we want to do, and we've got to get it better.
Now, hopefully, we'll come on to the 10-year plan. I mean, the other area I must consider just very briefly before we dive into the detail around that, because it's been so prominent for many months, of course, is the issue around maternity. Baroness Amos's initial report had some fairly shocking observations, and there's a new early warning system, and this is an area very close to both of your hearts. So just a comment from you, because there's a lot of pressure also on the staff who work in maternity from patients with all of this coverage around maternity.
Yeah, we know maternity has been a real focus, and I think it's important to mention that there are a lot of great midwives doing some amazing things out there. And recognising that the way that we deliver maternity service is really shifting. So there is much more of a surgical intervention now. Lots of caesarean rates are going up. So it's a real shift from the traditional way the maternity services were delivered. And I think it's important for us to focus on what the future looks like as well, and what we need for our profession, and to make sure that we bring that pride in the profession as well. Because it isn't, when we talk about the Amos Review, it isn't just about midwives. It is around the whole multidisciplinary team, including obstetricians as well.
You said Baroness Amos's initial report, and the final one thing comes out much later in 2026. You said it was a crucial step. I wanted to expand just briefly on health equity and maternity, because obviously Health and Social Care Committee reported in September about black maternal health. The department's response was out on the 16th of December in 2025. And there are some important issues that need to be top of the agenda for black maternal health as well.
Oh, absolutely. And I think, look, there is a lot of work still to do in maternity services. And, as Karen said, look, there's lots of good work that is also taking place, but that maternity services are not in the state that they need to be for the women, babies and families of this country. So there's much more to do. And the inequalities are stark. The inequalities for black and Asian mums compared to white mums and babies is significantly different. And also for those that are in the most deprived populations as well, which is why we've got to make sure that our maternity services are doing those things, those extra things for those with the biggest vulnerabilities in our communities. And also we tackle things such as racism, discrimination in our services as well. So really great that we're rolling out a program with the Race and Health Observatory, very much focused on our leadership communities in our maternity and neonatal services, really addressing and tackling the issues around race and discrimination, and also, trying to make further inroads into reducing down those inequities that we've got in our services.
And if I can add,
Sure.
it's really important that we work with the families, and we recognise that there are a lot of voices out there that need to be heard, and really working very closely with them for how we need to shape the services going forward to the future.
I mean, the Race Observatory is doing some great work. We've had Professor Habib on here. It's been absolutely brilliant. I guess one of the other things, just to balance the picture a little bit, there are many challenges you pointed out. The CQC report did point to some improvements that had actually happened in maternity care. So hopefully it's a topic if we manage to persuade you to come back, we can tackle again.
Absolutely. And look, and you mentioned the signalling system. That's a really good development. Actually, we're trying to get upstream and spot issues much sooner. And I think, as Karen said, look, actually really listening to the voices of women and families, and making sure that is ingrained in every part of our service is so critical.
let's talk about the 10-year health plan, but there's so much to talk about, but I want to zero in on a couple of topics that are specific to nursing. We've had also the medium-term planning framework, which was 3 years rather than the usual 1 year. And the 10-year plan, I think Mr. Streeting has called it turning the NHS on its head. And it's got some very, very ambitious plans around constitutional standards. But let's focus a little bit on that shift left to the community. Nurse consultants, consultant midwives, there's a big focus and opportunity around nursing's role in the community.
Absolutely. And I think we've just acknowledged that they play a key part already. We've got lots of great community services out there, lots of good work, and really, really bolstering that and focus on that, because there has been a tendency to focus on in hospitals. But there is amazing work going on and strengthening that and increasing that sort of level of seniority, advanced practice out in the community, and also really encouraging our students to actually see themselves in the community services. When I trained, it was like you had to do the hospital and then go out into community. We're really reversing that, because actually care in the community is the way forward. And we absolutely need to be thinking much more about how we turn the dial on that and really bolster that. And we'll do that through some of the integrated neighbourhood teamwork as well.
And 90%, I think, of hospital nurse placements are still in hospital, which is now going to change a little bit. You've talked about the work that nurses already do in the community. Should we just talk about social care? Because there still seems to be not an immediate connection, but nurses are very ubiquitous in social care delivery.
They really are. And again, what we are doing work is to really help people to see their futures in social care as well, because it's another integral, as you said, group of nurses and individuals. And I've been out to some of the care homes, met the social care, and you've met Deborah Sturdy, who does a fabulous job of really focusing in on social care nursing. And I know that is absolutely where we'll be moving forward.
In terms of the workforce in that community setting, there are some challenges, which I just want to get your views on that. I mean, let's talk about district nurses. Those numbers have fallen by 43% from 2009-10 to 2023. And demand is growing. So there are going to be some policy levers that are going to make this quite a complex shift.
Absolutely. And I think, look, Karen makes a really good point, because we've got to get much further upstream on this, particularly around, look, if I think back to my training 30 years ago this year, I did probably, I think, 12 weeks out of 3 years in a community setting. And that's still the case for many of our student nurses. So how are you ever going to get exposed to the opportunities, actually understanding the acuity of patients that are cared for by our community nurses and our community teams? So we've got a big piece of work actually to do to get upstream of that. And also we've got some, I think, professional changes we've got to make about perceptions around this as well, because I still hear too many times colleagues say, well, you can't start your career in a community setting, you've got to start your career in a hospital setting. That's nonsense. We've got to stop that. Because if we don't, then we're never going to make that shift. But yeah, you're right. We're going to have to do many policy decisions and areas to help drive this. And I think there's also a bit of shift in thinking. If I think about through my career, I'm a very hospital-based nurse. I've had community services as part of my portfolio in my chief nurse role, but I've probably come to this late. I've probably, some of the decisions, if I was back in a trust as a chief nurse, I'd be having a very different conversation now from what I know with my community colleagues. And that's one of the shifts we've got to do, because we've got to think about, let's not just put in hospital capacity. What are we doing to actually really drive some of that community capacity?
And that will also be predicated, obviously, there's going to have to be funding that's going to be shifted from hospital-based to community. And also safe levels. I mean, Steph Lawrence, of course, spoke very eloquently about safe levels of staffing in the community.
Yeah, I mean, there's work to be done, and I agree. And the Queen's Nursing Institute for Community Nursing do a fabulous job in supporting that voice of the community nursing profession as well. A bit like Duncan, I spent a lot of my time in hospital, but I was fortunate when I was a respiratory nurse specialist then to go out into community and do outreach in the community, home oxygen therapy. So, but it was later on in my career. I'd already been qualified a little while. So I think the more we really start to think about what does it take to shape community nursing in its entirety, it's really important. And I had the joy when I was chief nurse at Buckinghamshire Healthcare to be in an integrated acute and community trust. And again, there's the shift around actually let's focus. The front door should be about the front door of the patient's door, not the front door of the hospital. So again, as Duncan said, we've got work to do, and that's where we'll drive that through the new nursing and midwifery strategy as well.
Yeah,
And
and I
sorry,
mean, if I
please.
can add, because I think there's also an important part, because we obviously talk about district nurses. There's lots of different nursing communities within the community,
Yeah.
and I think just to point out about health visiting, I think it's
Yes.
really important that that how do we give the best start in life for our children and young people. And having spent time out, I did my my Time for Nurses Day this year, and did a video on Nurses Days out with one of the health visiting teams in the Homerton. Amazing, the skill, the care, the focus on supporting mums and dads in the work that they're doing around looking after their children, but also kind of that ability to really spot signs of need and support. And so we've got a lot more to do to help support our health visiting workforce and meet some of the government ambitions around giving children the best start in life.
And that best start is also within the context. I think we should briefly touch upon prevention agenda. Obviously, obesity levels, 1 in 5 children have that. There's a big focus in the medium-term planning and the 10-year plan, of course, in terms of shifting cardiovascular morbidity. Talk about prevention, the role that nurses have. That's going to be a training issue, but also nurses are already doing that role in terms of supporting it.
They are. We've got some great public health nurses out there. And what we've been talking about is how do we make sure we instill that sort of training around public health very early on, so that actually we can meet that shift as it goes. And so I think there is acknowledgement that there is going to be a need for us to think differently of nurses. And the opportunities that you take when you're actually in front of a person, whether in a community or in their home or in a hospital, about how you get those preventative discussions at that time. So, and I think it's really important. And you mentioned obesity is absolutely an area. And in London, I know that you met Professor Kevin Fenton with lots of work going on around Million Hearts and Minds in London. Work that we're doing to also look at healthier choices for children in London are really important. And the more that we can integrate with our public health colleagues, with the communities, we work with the Mayor's office in London as well to also to join up to really work to tackle what's needed for Londoners.
So exciting time, a broad range of nursing roles that we've talked about, from hospital out to public health visitors. And I want to touch upon that variety, or diversity might be a better word, of the nursing profession. I want to start, if I can come to you, Duncan, on one point. And if I've got the memory right, there's a brilliant book on the history of the NHS by Geoffrey Rivet, and he quotes a probationer from a nursing probationer in 1946 in George's Hospital, giving advice about being a nurse. And it says that no woman should consider being a nurse unless they're prepared to accept hard work and the constant subordination of their will. So interesting, times have changed, but the gender part of that, I wanted to talk to you. You're the first male chief nurse officer, 1941, the office began. And you've called very specifically for stereotypes, gender stereotypes, in the name of diversity, to be put aside.
Yeah. Well, look, and I think one of the great things about the nursing profession is the diversity. And, we serve a diverse population, so we have to reflect the diversity of our populations as well. And look, we haven't made big inroads into the gender split within nursing. Still about I think 11% men and 89% women. Hasn't shifted greatly over that time, and some of this I think is still down to stereotype perceptions. And look, we're missing out on potentially 49-50% of the population coming into this profession, and it is a wonderful profession, whether you're a woman, whether you're a man. It's a really great profession, and that diversity of roles and opportunity to move around. We are 2% of the working age population of this country is a nurse or a midwife. That is staggering. And actually opening up those opportunities. But it means we are going to have to, as a profession, go out, talk about nursing much more. Yes, it's tough at times. Part of that is actually part of the attraction, because these are, stimulating roles, and, you deal with lots of different parts of the community. But I'm really keen that we go out there, attract more people into this, and particularly kind of change some of the stereotypes that still exist today.
Well, hopefully we'll see. They might, with your example, it might turn the dial from that 11%, and we'll see. I want to stay with the diversity point, if I may. We talked about Windrush and your mum coming over from Barbados. Now, I think it's 30% of nurses are non-UK nationals. And I wanted just to get your view on the role of international nurses. There's a lot of narrative at the moment around the role of international workers, whether it's social care. I'm staying with nursing here. That's an important part of the heritage of nursing and should remain something to celebrate.
Yeah, absolutely. I mean, we know that the inception of the NHS is built on the diversity of the people that came from the colonies, British colonies. My parents were part of that. They came with their British passports. They wanted to. My dad worked for British Transport. My mum came and worked for the NHS. It is built on that. It's the fabric. It's in the DNA of the health service, and actually is to be celebrated. And generationally, like myself, we've gone on to continue to serve publicly in this country, and that should be celebrated. And we think about in the last few years, we brought over all the nurses from international India and the Philippines and other places that have moved their lives and their livelihoods and left loved ones, like my parents did, parents and children behind, to come here. It is to be celebrated. And the great thing about in London, particularly because the diversity is very high in London, actually it reflects the diversity of the population. London is very vibrant, and therefore you can really reflect what's needed for those different communities. So we absolutely need to continue to celebrate the diversity of our people.
Yeah, I totally agree with that, and I think we also recognise that the experiences of some of our international nurses is not always great, and and we've seen some vile examples of racism and abuse towards our international colleagues, who I have to say, if you think about the scale of our recruitment from different countries over the last few years, the NHS would be in a far worse state than it is now if it hadn't been for those colleagues and those colleagues continuing to help and support the population of this country. So I do think it is absolutely something to be celebrated, and having worked with many international nurses over the years, it is just again that kind of richness that comes into the nursing profession, that the way in which we care and those experiences from around the globe, I think is it's one of the great things to celebrate about nursing. And actually another reason why colleagues should train to be a nurse, because or a midwife. You can work anywhere in this country, you can work anywhere around the globe. There's not many professions where you've got that ability to do that.
And there's actually an international shortage of nursing, as we know.
There is, yeah.
Staying with this final point, I wanted to expand upon this inclusion. You're both very, very passionate about this. The NMC register's got about up to 500,000 nurses, midwives and nursing associates in England alone. About 30%, 31% Black, Asian, minority ethnic. All the stats, staff survey, we don't need to go through all the details. Their experience of discrimination, whether it's by patients or colleagues, remains, despite 75 years of the Windrush, a real challenge. And I wanted to, Duncan, if you could address that, because that has a moral injury, that has an effect on patient care. And I know it's very high on your agenda in your role to tackle that.
Absolutely. And, look, and I think you cannot underestimate the impact that it has on people. And we've seen some of the terrible impacts, people waiting, for example, and being put in processes through the NMC, for example, and, trying to make improvements in that is absolutely fundamental, because it has an impact on individuals, but it also has an impact then at the end of the day for patients, because, if we've got staff that are working in environments that are not supportive, if we've got staff suffering from racism and abuse, that is not a good place to work, and that has an impact. And we've got to address that. And also, I'm really mindful of the fact that our leadership community within nursing and midwifery, and broader actually in the health service, is not reflective of the populations that we have within our nursing midwifery workforce. I'm really challenging ourselves through the development of our new nursing and midwifery strategy for England, which we're hoping to publish in the spring next year, to look about what more we can do. There's been some great work that has been done, but we've got to break through this even more than we are now. So I think we've really got to challenge ourselves around what else can we do to really shift the dial on this.
I want to give you a platform here on this topic. I know that you sat on the NHS workforce race quality standard from 2017-21, and that's great, and it's all sitting there. But I really want to go underneath that, because you've spoken very passionately in the past, in your own journey from an enrolled nurse, I think that you began, where you were told you're not seen as a chief nurse, and even microaggressions relating to how one wears one's hair has an effect.
It does. And microaggressions are, in fact, little sort of insults of racism, to be fair. And I think it's important that and the reason I share that is because it's really important to understand what it really feels like and how it is for you as an individual. And I always say never invalidate how people really feel. And we know that we navigate the world very differently, because you show up, people know, they can see what you look, they can see you as a person of colour. And when I grew up through nursing, as Duncan's already alluded to, there weren't people who looked like me in senior positions. And this is not about tokenism, this is about representation. And it's also about fairness. And I'm very much about fairness and justice, actually. We all need to be given a fair shot at a job and seen to be in it. And I think it's really important. It goes back to the stereotypes around men and nursing and Black people in senior positions. We have to really challenge those stereotypes and really break down the nuances of the why and get underneath it. And I think it is unacceptable the way that our staff are treated, and sometimes how we treat each other. And it's the one gift that we have is to ensure that we look after each other. But the public have to do their bit. As Duncan's alluded to, without these nurses, without people like myself coming here, we would be in a complete different place to where we are now. So there is lots of work for us to do still to break down those stereotypes. I hope I do a little bit in my, we all do our little bit where we can, but it's not mine to carry alone. And that's why it's really important, people like Duncan, who are in his position, really championing the importance of us really addressing racism and addressing discrimination, all its forms. Actually, it's unacceptable, but we also recognise it's in the fabric of our society. And that's why speaking to the communities and understanding that how important it is that we eliminate this, because the health and the well-being of all of our people are affected by it. Actually, not just us as Black and brown people, it affects everybody.
And just one final point there, it's actually, we have a tremendous responsibility, all of us, in terms of the language that we use.
Absolutely.
Communities that are hard to reach are
Yes.
actually seldom heard. So
Yes.
just speak briefly, because that language
Yes.
is critically important. Sometimes it's the current political narrative in some cases dismisses it as EDIs are nice to have, or even actually shouldn't be here.
Yeah, and I think it's, I ban that sort of language. Everybody knows, if anybody says it in a room, I'm always like, please don't say that, because it does infer that the individuals are a problem, and we've got to be really intentional. I've talked about this in the past, intentional about the people that we're reaching and how we reach them. And one size does not fit all. And I think, and also many of our colleagues come from those communities who can really help to guide us into how we reach into those communities. So there's definitely language is definitely something we've got to challenge. We've got to reset the perspectives, and there is a journey for us all to go on. And we're all doing our bit, and we ask that the public do their bit, and we also know that there are still many people that we know need to go on this journey in leadership, because actually it comes from good leadership, and also not being a bystander, standing by and watching and hearing and witnessing this is unacceptable. So there's a journey that we're all on, as you know, and we continue that journey and fight the good fight, because it's really important. It's important for our communities and important for our people.
Yeah.
And for us all.
And you see this absolutely play out in health outcomes,
Yeah.
and I think,
Absolutely.
we've got more to do, but even just kind of demonstrating and showing the variation that we've got. I mean, we've talked about, the outcomes, the maternal outcomes for Black and Asian women compared to white women and babies. You can play that through a whole load of other parts of, health, cancer outcomes, for example, so we have got to make sure we're putting visibility on this, and then we are making sure that the services respond to that.
Hopefully everyone's listening and taking heed. Just want to step back the final part of the podcast to look into the future. It's a defining moment in your words. I think it was I can remember 1986. There's something called Project 2000, where the education framework for nursing went to hospital-based and supernumerary nursing. I think 1999 was the last strategy making a difference. You're embarking on a brand new nursing strategy, national one. Tell us a little bit about the drivers for that, and you're super excited about what this could offer.
Yeah, no, that took me back to 1986. Well, I wasn't quite. I was in primary school in 1986.
Thanks,
You'll be
that's making me
pleased to
feel
hear.
really
Sorry
old.
about that, but actually, I was a Project 2000 nurse.
There we
So
go.
you know, but so look, I think this is a really exciting opportunity. We are really focused on what the nursing and midwifery profession needs to do for the population of this country. So you know, if you think about healthcare changes all the time. We've got some really big areas such as, you know, the advancement of technology, science, genomics, and our professions have to respond to that. And I'm really pleased that, you know, the 10-year health plan reflects the fact that we are developing a nursing and midwifery strategy for England. It's really important. As I said before, 2% of the population, nearly 660,000 nurses and midwives in England alone. We have a significant impact in every community, 24 hours a day, 7 days a week. Whole variety of roles and skills and opportunities, but we've got to do more to help support our workforce, develop our workforce, support those shifts from hospital to community, recognise our role in areas such as public health, research, you know, and the economic impact that we have as nurses actually on this
Should be
country alone. So
celebrated.
it should absolutely be celebrated and, you know, lifted more. But we've also got to make sure we are attracting more people to the future of our professions. So, you know, how we go out and how we talk to people about the profession is really important as well. And this isn't just a strategy for nurses and midwives in the NHS. Nurses and midwives work in the military, they work in
Prison.
social care, prisons, charitable sectors, lots of different places. So actually I feel really energized about this because I think it's a great opportunity to look ahead and think about all the things that we've got to do to try and shape healthcare, prevent ill health, and actually our professions are absolutely core to that.
And huge amount of excitement. I've got to feel that here. One of the pillars of it is around the culture piece, and kindness comes out really strongly, I think, as part of the goals.
Absolutely. Yeah, absolutely. And I'm as excited as Duncan actually, because it's ambitious and it's the first time we've really looked at nursing in all its forms. And it goes back to the points that Duncan made earlier, seeing yourself in this, and we've got more to do for young people being attracted into it, as mentioned earlier, because actually there's a wealth of things that you can do, and you can shape your careers now in so many different. Who knew that we would be chief nurses? I didn't. The 18-year-old me would never have imagined I'd be sat here saying I'm the chief nurse for London. It's a real privilege. But going back to the kindness, it has to be threaded throughout, and it's not a nice to do. It's a must-have. It's so important that whatever we do so with kindness and compassion, and that's why it has to be the golden thread throughout it. It's really integral to our profession, but also to the professions that we influence. We are the biggest profession. We interchange with so many people. And going back to the point about being 2% of the working population, but also in the fabric of our people. So if I look at my family, how they look to me in a way that, you know, other professions aren't seen in that way. When you go home, you're still a nurse, really, and your neighbours, the people around you. We have such a huge impact, and it is a lifelong commitment that many of us have to this profession, and it comes with such joy, such satisfaction, that actually many people can't say how much they've really touched people's lives in the way that nurses and midwives do. So I'm really encouraged and excited too about what we will be able to bring forward for the future of nursing, because it's so needed.
And it does impact on my mother has comorbidities and
Yeah.
supported by a fantastic nurse in the community. So I see upfront and real. Just one other point on the strategy. Tell us when we're expecting it. But one strand I picked up, it goes back to this diversity point, I think. You started off as an enrolled nurse, and you've gone off and done your master's in advanced practice at King's. You went to, I think, Wales to do your first degree
Yep.
and then a master's. So the different routes. And the 10-year health plan talks around increasing the number of apprenticeships. 2,000, I think, was the number. But talk to us a little bit about the strategy's vision for different pathways for education, because that also has an impact on different communities having access to becoming a nurse.
Yeah, definitely. Well, look, we should expect to see the strategy come out in the spring. There's been lots of great work that's been done, over the last few months, trying to gather views and ideas and thoughts and shape this from our professions and others. Um, I think one of the great things actually we've seen over the last few years is increasing the opportunities and to actually join the profession and have different routes in. And I think, having spent time, for example, with nursing associates that would never have got into nursing had that route not been available to them. And, many have now gone on to, top up and to become fully registered nurses. But those routes those apprenticeship routes are really important, as well as making sure that we've got the more traditional routes through traditional pre-registration education. But it doesn't stop there. So one of the things in the strategy is not just about how do we attract people in those different routes, but then what are we doing around the post-registration support development and that critical thing within nursing, which is we're always learning. I'm still learning today. I'm sure you are. And that is one of the great things about the profession, is that ability to carry on and change and evolve and learn.
And talking about that journey, one of the penultimate points I'll reach is the medium-term planning framework talks about the creation, which the 10-year plan talks about a leadership college, clinical leadership college. We've had reviews going back to mid-staff, Berwick, Messenger, Pollard, talked about how important it will be for nurses to play a leadership role in this transformative landscape for the NHS and social care.
Yeah, I mean, I think firstly, leadership is a bit more of a behaviour than the title. And actually, there's opportunities for everybody. And I do want to also just give a shout out to our support workers as well, because they play an essential part in supporting our professional nurses to do their job well. So it's really, really important. And I think it's how we shape for the future is going to be really, really integral.
The leadership is going to be something that you're going to be encouraging nurses to grab, I guess, with both hands.
Absolutely. And, I think nurses and midwives are already, in significant leadership roles, driving improvement. I think we need to put some more visibility on that, because, are fundamental to the 3 shifts in the 10-year health plan, fundamental to the nursing and midwifery strategy. And also, how do we advance in areas such as, I think, if you think about digital AI, the opportunity there is for nursing and midwifery leadership in those spaces, in genomics, in those kind of scientific advancements, and in kind of, the space around education and research. We are fundamental to that. But I think there's much more we need to do to showcase it, but also lift our place in that and really kind of use it to drive improvements for our populations.
Well, I'm hoping you're both going to come back when the strategy is published and explained. But I'd like to finish off with one personal question, if I may, again. Duncan, going back to your start in your career, ironing your uniform, I think, for your first shift. I've seen that interview. Someone who's considering, maybe at school today, doing GCSEs or A-levels or apprenticeships, or just thinking about, perhaps they're slightly older people, they want to think about joining the profession. What would you say to them?
Do it. It's simply, look, if you're interested if you've got a kind of little thought in your head, should I think about nursing? Have a conversation with nurses, have a conversation with, I would love, anybody can contact me. They can contact, Karen. I would be delighted to talk to people about the nursing profession, the opportunities there are to move careers and to change around within the career of with nursing. That ability to move to one bit of the country or to try something new in a hospital or a community or a different setting. Just go for it, and don't be put off by people's stereotypes or views. So when I said to people in school, I want to be a nurse, teachers tried to put me off. They said, why don't you go and be a doctor? I am so glad that I stood my ground and became a nurse. This is always what I've wanted to do and continue to, love it. So don't be put off by people.
Absolutely. I'll give you the final word, Karen. Just briefly, I've mentioned your MBE, I've mentioned your honorary doctorate, and et cetera, et cetera. But what I found really interesting, you said one of the proudest things for you on your journey was to be able to find your authentic voice. So with that authentic voice, those who are considering the profession, a couple of pointers about what they should do?
Yeah, they absolutely should go for it because nursing is just, there's not just one thing. So you can shape your career, you can make it your own, and actually fundamentally you can have a journey, change it, you can move. And also, like me, you can do so many things with it and move forward in your career, but also just the breadth and the depth of the things that we do. But fundamentally, what I'll say to people as well, there are very few jobs that you will really feel you've made an absolute difference. And so whenever I step away from this profession at some, in the future, because, like all of us, we
Not for a long
retire,
time,
not for a long
please. Yeah,
time,
yeah.
not for a long time. But, you will look back with fondness, and there are very few careers that you can really say, I've made a massive difference and I've left an indelible mark on people's lives in a way that actually you will never really truly understand. And I think it's really important for people to understand what an amazing thing that you'll be doing to join this amazing profession. And I would say go for it. Absolutely.
On that inspiring call to action, Karen Bonner, Duncan Burton, thank you so much for
Thank
joining
you.
us today.
Thank you very much.
Pleasure. If you enjoyed this episode of Voices of Care, please like, follow, or subscribe wherever you receive your podcasts. If you want to learn more about how we're turning the dial on the health and social care debate, please visit voicesofcare.com. In the meantime, I'm Sahel Mirza. Thank you very much for joining me on this episode, and I look forward to seeing you on the next one. I think that's what they call a wrap.
Voices of Care, the healthcare podcast.